Thank you for having me today. And thank you for that amazing intro. So, my name is student Dr. Aulakh, and I'm an anatomy fellow here at KCU. The project that I worked on looks at how wrist anatomy and demographics relate to carpal tunnel syndrome risk. So, just a introduction, carpal tunnel syndrome, I'm sure you know, is super common. Basically, it's where the median nerve gets compressed at the wrist, which can cause pain, numbness, and just make your hand not function right. Most people only talk about the flexor retinaculum, but this project dived deeper and we looked at structures that don't really get much attention. So, like the extensor retinaculum, palmar carpal ligament, even how the shape and width of the carpal bones can play into it. On top of that, we wanted to see how things like age, height, and BMI might increase someone's risk. And ultimately, the goal was to understand carpal tunnel as more than just one thing. It's not just the anatomy or just the lifestyle, it's a mix. And if we can understand that mix better, we can hopefully catch it earlier, prevent it better, and treat it in a way that actually fits the patient. So these two images here help break down what we're actually looking at when we talk about carpal tunnel anatomy. And let me get my laser pointer here. So on the left, on this image here, you have a detailed illustration showing the flexor retinaculum, palmar carpal ligament, and the median nerve running through those structures. And this is a pretty good reminder that it's not just one structure at play. We have multiple layers and ligaments that contribute to this syndrome. And on the right is a cross-sectional view. Both these images, by the way, I had a friend draw up. Um, but on the right, we have a cross-sectional view, which really puts things into perspective. So you can really see just how tight that space is and how the flexor retinaculum basically forms the roof of the tunnel, and this is typically where the nerve gets compressed. And you can also see the bones surrounding it and how they create the base. What we're trying to do with this project is zoom out a little bit and look beyond just the flexor retinaculum, this top part here, and ask how do the other structures like the extensor retinaculum, bone width, even things like BMI and age contribute to that compression. So for our study, we used 28 adult cadaver upper limbs. We had 15 females, 13 males, and they were all donors from the Midwest. We specifically focused on measuring the flexor and extensor retinacula, the palmar carpal ligament, and the carpal bone width. Everything was dissected using a standardized technique to make sure that we preserve the anatomy exactly as it is in the body. And then we use a digital caliper to measure everything with a really high accuracy down to zero point 0.0 millimeters. And just to make sure our measurements were reliable, we took high resolution images of each dissection, and those were also used for calibration and help run the descriptive statistics accurately. So these are two photos from our dissection process. The figure on the left shows how we used a scissor technique to carefully expose the flexor retinaculum and the palmar-carpal ligament. And the goal here was to preserve the structural layers while still getting clean access to that area for measurement. And then this figure here shows the distal boundary of the extensor retinaculum, and you can see how the structure thins out distally, which actually helped us pinpoint exactly where it ended. And it's thicker closer to the forearm and gets progressively thinner as it extends towards the wrist. And this is important for our measurements across each specimen. So these figures here show how we used the digital caliper to measure the thickness of the flexor retinaculum, palmar ligament and the extensor retinaculum from left to right. Um, so we took these measurements consistently at the same landmark for all specimen. And getting these dimensions was key because it gave us insight into the structural variations beyond the ligaments, which could play a role in carpal tunnel development. Um, and you can see from these images how different the measurements are, even though they're from the same wrist. So here is what we found. The right extensor retinaculum actually got longer with age, and the medial side was always longer than the lateral, which points to some built-in asymmetry in the wrist. We also saw that on the left side, the palmar-carpal ligament length on the lateral aspect had a positive correlation with age. And height showed up as a big factor as well. It correlated with both the extensor retinaculum and flexor retinaculum lengths on the left side, both medial and lateral. The carpal bone width increased with height, which makes sense, but interestingly, the carpal arch actually decreased as the age went up. BMI really didn't have a connection with the extensor retinaculum size, so that wasn't as significant. Um, but yeah, overall, these results suggest that both aging and height, not just soft tissue, can play a role in how the wrist structure can change, which could impact someone's risk for carpal tunnel over time. And hopefully this image isn't blurry, but this is a visual breakdown of the um, two of our key findings. So the blue is indicating the right lateral extensor retinaculum, and the red is indicating the right medial extensor retinaculum. And basically, this figure is showing the relationship between age and the right extensor retinaculum length. And what stood out to us was that the medial extensor retinaculum, the red dots, were not only longer overall, but they had a stronger correlation with age. So as people get older, that medial extensor retinaculum length tends to increase more than the lateral. And that also supports the wrist asymmetry that we mentioned earlier. Then in this figure, we are looking at the carpal bone width versus age. And on the x-axis here, we have age, and the y-axis, we have our carpal bone width. And you can see a slight downward trend, meaning as the age is increasing, the overall carpal bone width decreases just a bit. It's not dramatic, but it's there. And both of these trends highlight how wrist structure changes over time, which is important when we're thinking about the long-term risk and anatomy-based variations. So, one of the big takeaways was that the extensor retinaculum gets longer with age, which might be due to some changes in elasticity or just long-term use of that wrist. We also noticed that the medial side of the extensor retinaculum was consistently longer than the lateral, which shows that there's some natural asymmetry going on that can impact how the carpal tunnel can behave structurally. Another key finding was the correlation between height and both the carpal bone width and the length of the wrist ligaments. So that makes sense because height equals bigger structures, but it also means that the wrist morphology isn't going to be a one size fits all. And that really matters when we're thinking about carpal tunnel risk. And then on the flip side, we found that the carpal arch becomes flatter with age. And you might be asking yourself, what do you mean by that, Sim? What is the carpal arch? So this is the carpal arch that I'm talking about here. And with age, it flattens. So that can mean there's less space in that tunnel over time, which puts the median nerve at risk for a higher risk for compression, especially in older adults. And BMI didn't seem to correlate with the size of the extensor retinaculum. So Um, while body weight might matter in other conditions, it didn't seem to impact these risk structures. Um, oops. So overall, our data just adds to the understanding that carpal tunnel risk isn't just about overuse, but natural variability in anatomy. So screening and treatments should definitely consider individual structural differences, especially as people age. And yeah, that's my project. And just to recap, it showed that the carpal tunnel isn't just about repetitive movement. There's a whole anatomical and demographic layer to it. Things like age, height, ligament differences that can actually impact the risk. So hopefully that adds to the conversation around a more personalized screening and management of carpal tunnel syndrome. And yeah, if you have any questions, I'm happy to take them. But thank you for your time and for listening.